Hello, I'm Josh Imhoff with Richmond Rising. We're here today at the Fire and Police Training Center to talk to Kalie Anderson and Heather Hall, members of the Richmond Fire Department's Community Paramedicine Program. Kalie, Heather, thanks for joining me today.
Thanks for having us.
So the Community Paramedicine Program was started last summer by the Richmond Fire Department, and not very many people in the community know that the Richmond Fire Department has this paramedicine program. Could you talk a little bit about what you do as a community paramedicine person?
Sure. So Heather and I are both social workers with the paramedicine program. We have a patient base that consists of people who are struggling with mental health disorders, substance use disorders, and elderly people who have a risk of falling in their home. So we kind of go out and make contact with people and offer them help getting connected to different services for any kind of issues that they might be having.
Oh, cool. So that's people with mental health issues or substance abuse and elderly as well? Mm-hmm. Yeah. Great. I didn't know that Richmond Fire Department had that, so that's a really great service that you guys are offering. So this is a grant-funded program?
It is.
Yeah. And that was a $1 million grant that the city got last year from where does that grant come from?
It was from the Indiana Department of Health, awarded by the CDC.
So you guys go on calls, that fire or police calls to meet these people?
We do.
Yep. Sometimes we'll be on the ambulances with dispatch if medics or firefighters or officers go on scene and feel like it's a situation that is appropriate for our program, they can request dispatch to send us on scene as well, or we can meet at the hospital, just whatever's most needed and most appropriate for the situation.
Mm-hmm. Sometimes if a police officer wouldn't be appropriate to handle one of the calls, they'd call you to...
Yeah, it's an option for sure. Yeah.
Mm-hmm. Oh, great. And then you guys do follow-up sort of programs with people?
We do. So we also have a referral system in place. So the medics, firefighters, police can send us a referral after hours if we're not, working and on call for the day. So we'll go out and follow up on calls that they went to if we feel like we're needed, or if they send us a referral.
Well, sounds like a really needed program here in Richmond and our community. So, thank you for doing that. Both of your background are as social workers?
Yes.
Mm-hmm.
Yeah.
Yep.
What sort of resources are there in the community that you can connect people to?
Well, there's some counseling services, there's case management services, rehabs, so it can be residential, non-residential, methadone, I say this wrong every time. I say the wrong one first. Buprenorphine.
I've never even heard of that.
Yeah, it's naloxone, right? Suboxone. See? No. So the naloxone are the kits that we have in our boxes. So, yeah. So there's all of those sort resources, but a lot of times the system can be very complex, very complicated, very intimidating, especially for people who don't have resources and may not understand how it works. So a lot of times we can be there to bridge the gap for those individuals.
And likely a lot less intimidating than maybe a police officer for someone who is experiencing substance abuse disorder. Having a social worker be able to connect them to the resources. You had mentioned boxes. Do you handle like the boxes at the fire stations? Could you talk about the what do you keep in there?
So we have, they're called Nalox boxes, and they're on the outsides of stations 1, 2, 4, and 5 around the city. So we keep Narcan kits in there, and inside the kits there's information on how to recognize an overdose. There's a dose of Narcan. There's also fentanyl test strips in those so that they can test whatever is being used to make sure that fentanyl is not present. And then there's also our business cards are located in those as well.
Yeah.
Great. So if someone needs test strips to test their substances or need a Narcan, they can just go to the box day or night and pull that out.
Yep, no questions asked.
Yeah, and they do not have to, I think it's important for people to know, like they don't have to go to a person and ask for it. It's a serve yourself situation, and it's really surrounding harm reduction philosophy and techniques to, if people are going to use, but we can help them do it a little bit more safely. So it doesn't enable it.
Mm-hmm. Yeah. Lets them live long enough so you can, get them the resources they need. And
yes, absolutely.
Great.
And before too long, I think we're going to be adding xylazine test strips, which is kind of a newer drug that's has already entered the drug supply. It's not a future tense, unfortunately. So those should be coming into our kits as well here fairly shortly.
Well, like I said, the Community Paramedicine Program has been around for almost a year now. What sort of have you been able to see any effect on the community from the program so far?
I think we have. I think just the number of overdose calls is decreasing. We're making connections with the police department, so we can also make connections with the people that they're dealing with and try and get our services out there. So I think that there's been some positive changes happening.
Yeah, and over time we're seeing more communication that's being able to happen, for example, with law enforcement and the hospital. So slowly we're, establishing some connections that can make it more effective over time.
That sounds great, especially with your skills and resources and connections. That's really great to get it to the people. And I bet showing up where they are is probably a lot easier than asking them to come, to a treatment facility or to a healthcare or a law enforcement facility. If you're able to meet them in the home or something like that, it seems so important.
Yeah, definitely. And unfortunately, a lot of our population is affected by homelessness as well. So that also creates additional barriers that maybe none of us would have, where we don't have an address, we don't have a safe place to sleep at night, and where to find them, how do they get to appointments and things like this. So sometimes those are things we can also help with.
The future of the program, after this year, are there any future plans for the program? Do you plan to expand it or bring in new people?
I mean, that is definitely the goal. When this first started, the plan was to have a paramedic on board for the program, and that kind of didn't pan out, so we kind of shifted gears a little bit, and that's when we brought Heather on as the second social worker. We have an intern currently working with us as well, and then planning on, in the works, getting peer recovery specialists to come in and kind of help us go out and talk to people and connect them with services and just allow them to have that extra resource that maybe they can connect with a little bit better.
And what is a peer recovery, or what did you call that, peer recovery resource?
Yeah, peer recovery specialists, or they also call them
peer recovery coach.
Peer recovery coach. So typically they are people who are in recovery, so they have lived experience and they kind of help navigate treatment options for people, and also they can just be there as a support for them.
Yeah. A lot of times people who are in the middle of their addiction, they're much more receptive to hearing somebody that they know has been there and done that and had to deal with it and has been able to overcome it. So even where we may be less intimidating than, say, officers, they're less intimidating than us. So that it's just hopefully one more bridge to build into the gaps of our systems. So
That's awesome.
yeah. Another thing we would hope to be able to do is expand our hours of operation, because we can't control when someone overdoses, we can't control when people are having mental breakdowns or becoming suicidal or things like that. So it would be helpful certainly for all the first responders who are involved in the process to know that we're available 24/7 as opposed to just typical business hours. So that's one goal on the horizon for us to try to work towards.
That's great. And do you guys provide training to any first responders?
We don't provide training. The program did purchase training for every member of the fire department and the police department as well. So it was naloxone training, kind of stigma reduction training, and then training on how drugs affect the brain. So far we've gotten that done.
Yeah. That's great. So our first responders know a lot more how to deal with, and what the people, when they get called out on drug calls, they might have a better understanding of what those people are going through and what to expect, thanks to the paramedicine program.
Yeah, that's the hope.
Yeah. So you both work, the paramedicine program is through the fire department, but you work closely with the police department as well?
Yes.
Yeah. Would you say most of your calls come through the police department?
We do get a lot from them, but I would say the majority of the calls come from the 911, the EMS calls.
Yeah. And you might ride out on your own vehicle or ride in an ambulance to the call if it seems
just
like you would be needed.
Situation dependent.
Yeah. You go out on your own calls, but then people can also be referred to you, or you can get referrals. What's that process, or what does that look like?
I will let you answer that.
So each organization has their own QR code, and that sends them to a form that, they vary a little bit just depending on what their focus is for their role with the patient. So we have self-referrals right now. We have Richmond Fire Department and the Richmond Police Department. We don't have any others right now, do we? Oh, well, A Better Way now has one.
We're currently working on one for Reed Hospital.
Yeah, so, the key players in the community that can provide resources for these populations of people, we're going to try to make sure that they all have a process to be able to send us referrals. So.
That's great. That's great that you're working with these other organizations that are already out there in the community and dealing with the same issues. Sounds great that you guys are all working together and communicating and referring each other to the services so we can best serve people.
Yeah, and I think it's part of, like we talked about, having such an intricate system that can be very complicated and complex, is having enough information about the various providers and knowing what can they offer, what can't they offer, what can they do, what can't they do, helps us know where to send and try to get people connected with services too. So it kind of it can be very frustrating for people when they finally jump through all the hoops, but they're with the wrong provider. So then they're like, oh great, I have to start back up from scratch again. So hopefully we can cut out some of that complicating stuff for people.
One thing I was wondering was, how common is a community paramedicine program? Is that something that most cities have, or? Not here, I don't believe. It's kind of on the rise all over the country. I believe we've had the privilege of going and meeting with some of the paramedicine programs that are already kind of off the ground and have been running for a while, just to kind of observe them and see what works best for them and what hasn't worked for them. So that's been really, really good learning experience.
Yeah. It's helpful to see what their growing pains were too, because they've dealt with a lot of the same barriers and obstacles that we're dealing with right now. So it gives us a lot of feedback to how to create the foundation of our program and start building it.
What's like the biggest hurdle you guys have faced building this program?
Oh, we both respond to that. Okay.
Biggest hurdle.
Oh.
I would say at this point, just kind of getting the word out there, you know, letting people know that we're here and we're here to help, and making people aware of what we can help them with. So, I mean, in the beginning we were showing up and people were like, who are you? But now it's kind of, now it's kind of getting to the point where people are getting more familiar with it. So I think that's been one of the biggest challenges.
Well, thank you for coming on to this show, because this is a great way of spreading the word about the Richmond Fire Department Community Paramedicine Program.
Pleasure to be here.
Yes, I'm very glad. Thank you.
So what is there anything that you want people to know about the Community Paramedicine Program that we haven't covered yet?
I would say my hope is that they just know that they can come to us even if we don't get a referral. We're here to help. We're trying to create a safe space for people to ask for help without stigma or judgment or anything like that. So I think that's the one thing I would want everyone to.
So would they just call the fire department, or how would they get in touch with you and your awesome resources?
They can call the fire department. We also have a centralized email that will go to both Heather and I, and it is cpp@richmondindiana.gov.
CPP, like Community Paramedicine Program? Yeah, at richmondindiana.gov.
Yeah, and they can connect with us on Facebook too. I think it is Richmond
RFD Community Paramedicine Program.
Okay.
What's something that people might not realize about the community that you serve, about people that have substance use disorder or dealing with mental, emotional sort of issues? What's something that you wish more people would know about that community?
I would say, you know, it's everywhere. It's everyone. It's not people that look a certain way. It's not people that behave a certain way. It's not people of certain socioeconomic classes. It affects everybody. People may not be comfortable talking about it, may not want to know about it, but it's still there. And so, you know, kind of the stigma reduction and stuff like that, it's judging people for it is not going to help, and it certainly won't help it go away. It's everywhere.
I would also say, you know, things like mental health disorders and substance use disorder are like chronic, recurring diseases. We hear a lot that, you know, it's a choice, and it's not. So I think if people are, you know, more open to the idea that harm reduction can work and can save lives, and, you know, people need help, it would be a whole lot better.
One thing you had said at the beginning was that, you know, we've talked a lot about substance use disorder and mental health issues, but you also get calls to help elderly individuals or maybe homebound individuals. Could you talk a little bit about how you can provide services to those individuals?
So we kind of assess the situation, whether or not they have caregivers in the home, things like that. We have a home safety assessment as well. And then we can kind of connect them to resources for home health care or respite care for caregivers who might be in the home with them. And then, you know, just kind of help them out with any kind of safety measures that might prevent future falls.
So if someone calls emergency because they've fallen in the home, you know, paramedics might go out there, but then you would follow up with them or also go on the call and help prevent a future fall. Maybe help them secure things, or like how can you prevent someone from falling? Like what sort of strategies or things can you do?
Well, part of the home safety assessment is making sure there's, you know, like not a lot of clutter in the home. There aren't things that are going to be easily tripped over. If they don't have things, you know, like walkers or canes, things like that could help them, grab bars in the home, like especially in the bathroom. We can help with things like that. But I think one of the biggest services that we get in place for them is home health care. A lot of people don't have it. So just getting somebody in the home to help out with day-to-day activities, it can be a big help.
And that would be a referral to another organization in the community that you can help them with, right? So they can also call the Richmond Fire Department, if they or a loved one is elderly and needs help in the home, and then you can help connect them with the right resources.
Yep.
Yes.
Let's see, is there anything else that we haven't covered yet about the paramedicine program?
I think part of that, and it hasn't been specified, but I think in our work it just kind of comes with the territory, is we're also a support for the support system of the individuals. So, it may be a family member trying to care for someone with a mental health disorder, and we can also provide support towards the family that's trying to assist their loved ones as well. So that it's just kind of a peripheral or collateral type of activity, but it's one that we deal with a lot.
Well, Kalie Anderson and Heather Hall, thank you both for joining me today at the Fire and Police Training Center to talk about the Community Paramedicine Program. This seems like such a great program that Richmond Fire Department has started. It's been around for about a year so far, and looking forward to hearing about all the outcomes for years to come that you guys have. So thank you for joining me today.
Thank you.
Thank you for having us.
And I'm Josh Imhoff with Richmond Rising. Thank you for joining us. We'll see you next month.